Hello, my name is Nicholas King and I'm a student veteran here at Lipscomb University. I honorably served my country as a non-commissioned officer in Bravo Company, 1505th Parachute Infantry Regiment, 3rd Brigade Combat Team, 82nd Airborne Division at Fort Bragg, North Carolina. I deployed in support of Operation Iraqi Freedom in 2009, and I sustained several mental and physical injuries while in the service. I am well aware of the struggles most of you face, but I have learned productive, effective ways to deal with my PTSD, and you can as well. Remember, there are always options and a way out of any type of situation. As a student veteran, you face a unique set of barriers to accessing mental health care. The objective of this video is to reduce the stigma of seeking psychological help among student veterans. To do this, accurate information about the mental health care field will be provided and common barriers to help seeking will be addressed. Local mental health resources will be provided at the end of this video. First, it is important to understand who mental health care providers are. There are several types of mental health care providers, each with different levels and paths of education, and each provides different services. Psychiatrists have a Doctor of Medicine degree, better known as an MD. They have attended 4 years of medical school after their bachelor's degrees and an additional 4 years of education and internship specializing in psychiatry after obtaining the MD. They can provide a complete medical exam, order laboratory tests, and imaging studies. They diagnose and treat mental disorders with psychotherapy and prescribe medications. Psychiatric or mental health nurses have a Master of Science in Nursing, MSN, a Doctor of Philosophy in Nursing Science, PhD, or a Doctor of Nursing Practice, DNP. They are also called Advanced Practice Nurses, or APRNs. They serve as case managers or general care practitioners. They also can complete a medical exam and order lab tests and imaging studies, but are typically under supervision of a medical doctor. They diagnose and treat mental disorders with psychotherapy and medication. Clinical social workers have a master's degree in social work or social welfare. They diagnose and treat mental disorders with psychotherapy and social interventions. Psychologists have either a Doctor of Philosophy in Psychology, a PhD, or a Doctor of Psychology, a PsyD. They can provide psychological testing in a wide range of psychotherapeutic interventions. They diagnose and treat mental disorders with psychotherapy and other psychological interventions. Counselors have a master's degree in psychology or counseling and can provide counseling to the individual or family. Some specialize in counseling couples or families. They can diagnose and treat mental disorders with psychotherapy. Case managers typically have a bachelor or master's degree in psychology and manage your mental health care. They do not diagnose, but work with you to plan and manage treatment and encourage compliance. They may come to your home to meet with you and make sure you have access to the health care you need. So, now that you know who mental health care providers are and how they are different, information about the help-seeking process might be helpful. Many studies have examined if psychotherapy and/or medications for mental health issues are effective. Most studies agree that counseling is at least as effective as medications in most cases. However, some mental health problems are best treated with medication and counseling rather than just the use of one treatment. While research does not show that particular types of psychotherapy or certain mental health care providers are more effective than others, it is clear from research that psychotherapy does work. Mental health services are utilized much more often than you might think. The Post-Deployment Health Assessment in 2006 and the Post-Deployment Health Reassessment in 2007 show that within a year of returning home, 35% of Operation Iraqi Freedom veterans utilized mental health services and 12% received a mental health diagnosis. In addition, about 21% of all students seek mental health services each year. That's about 1 out of every 3 returning service members and 1 out of every 5 students. As you can see, it's rather common for people to seek mental health care services. But some common myths and stigmas still keep those who need mental health care services from seeking treatment. For example, one myth states that only severely mentally ill or, quote, crazy people seek mental health care services. That's simply not true. All types of people seek counseling for a variety of reasons. Some people seek counseling for relationship problems and others seek treatment for substance dependence. While both of these situations cause distress, neither person is, quote, crazy. Another myth about seeking psychological help is that your superior officers, professors, or deans will hear about your diagnosis and treatment. Mental health care providers adhere to a strict code of ethics, which includes confidentiality. Your records and anything you say is kept private with only a few exceptions. If your mental health care provider believes you are at harm to yourself or someone else, or if they become aware of an abusive situation, they are required to take steps to prevent harm, which includes alerting the authorities. They must also submit a diagnosis to your insurance in order to receive payment. Another situation that may lead to a breach of confidentiality is a court order requesting your records or a subpoena. No information is ever released to anyone else without your written permission. Confidentiality, including an opportunity for you to ask questions, is always discussed in your very first meeting with a mental health care provider. Another myth about counseling is that the mental health care provider will just give you medicine and hope the problem goes away. The only mental health care providers that can prescribe medication are psychiatrists and psychiatric nurses. No other mental health care professionals can even prescribe medicine. All mental health care professionals, including psychiatrists and mental health care nurses, work with you to provide the best individual care. This includes cooperation and input from you. You have choices in treating your mental health issue. The purpose of psychotherapy is to help you achieve your personal goals and gain greater insight into your life to help you become the person you want to be. How do you know if you actually need psychological services? The VA recommends seeking psychological help if you are experiencing the following symptoms: changes in sleep, appetite, weight, or sex life, headaches or other physical pain, muscle tension or weakness, decreased energy, motivation, or interest, problems with attention, concentration, or memory, irritability, anger, or short temper, feelings of guilt, worthlessness, helplessness, or hopelessness, unhealthy behaviors, misusing drugs, alcohol, food, sex, or other behaviors like gambling, or spending too much money to cope with stress or emotions, problems functioning at home, work, or school. You are now armed with accurate information about mental health care professionals and what seeking help looks like. But you may be thinking, I don't want to tell some stranger all my personal thoughts and feelings. Well, that's completely normal. Almost everyone who seeks treatment is at least somewhat apprehensive about telling a stranger about it. But remember, these are trained professionals who truly want to help you with your problem. They have seen many clients, and you will likely tell them nothing they haven't heard before. They are not there to judge you. They're there to help you. Another fear may be that letting all of those emotions surface may be too painful for you to handle. Those emotions are going to be there whether you express them or not. It may be that expressing them and learning to cope with them with the help of a psychotherapist is the best way to alleviate them. This is totally your decision and something you should definitely talk about with your psychotherapist. The following video gives you some more information.
Just like a disease or any other medical condition, the sooner you're able to address it, usually the better you are at finding a solution.
If you break your leg, you certainly don't shake it off and wait to see if it's going to get better. It's best if there's some trauma, if there's some trauma that the soldier has dealt with, or the service member, it's best that they get it seen early, treated early, so they can have a quicker recovery.
If we ignore a problem that is getting bigger and out of hand, it can have a lot of impacts on us, to include physical impacts, impacting on our relationships, can impact even on our jobs or ability to do the things that we enjoy doing the most.
Soldier thinks they're being tough if they can fix it themselves, where actually a soldier's being tough, mentally strong, physically strong, if they know when to seek help, and that's what we encourage. It's not a sign of weakness to seek help. It's a sign of strength to seek help.
They're having nightmares, that they're having problems, can't sleep, things like that. One of the first things they need to know is you're having a normal reaction to an abnormal experience.
If it's unusually intense, stronger than is really comfortable, that would be a sign that a soldier ought to be asking for information.
I would look at it as you're a more responsible service member if you are taking the time to stop, make a self-assessment and say, I've got something wrong, and seeking help to fix that problem.
I would remind them of their responsibility to themselves, to their family, to their unit, to their country, and tell them that it's not just about them.
We had websites and handouts and briefings. It was there. It was just the step to take it. That's the hardest part. You can have everything in front of you, but you have to step forward and be willing to take it.
If you're having problems right now and you're not happy with how your life is, the only way you're going to improve it is to seek help and to get the help you need.
I mean, their training in the military is all about, when they're planning a mission, identifying parts in the mission where you might need assistance and being prepared for it in advance. So if you know that at point C you're probably going to need more ammunition or you're going to need air support, then you call for that assistance. And we praise that in the military. I mean, that's a good sign of, you know, thinking ahead and planning and being prepared for points where you might need help. And I tell them the same sort of thing for this. If you know that you're going through a stressful time and there's going to be some road bumps up ahead, a relationship problem, some nightmares are occurring, plan for it and get the help that you're going to need, that air support lined up.
Whether you are Army, National Guard, who values loyalty, respect, selfless service, honor, integrity, and personal courage, or Navy, Marine, who values honor, courage, and commitment, or Air Force, who values integrity, service, and excellence, seeking help for a mental health issue is an important part of upholding your military and personal values. It takes courage to admit you have a problem you cannot solve on your own, and the honor and integrity you feel once you've solved your problem after seeking help is unparalleled. After all, which is better, trying on your own and failing, or reaching out to others and succeeding? If you or someone you know needs psychological services, a good place to start is your general care practitioner or primary care physician. In addition, your college is a counseling center that offers free counseling for all students. The following are other local resources.